Good afternoon, and thank you for joining us for today's VIA, VitaFlow in Association with You, live webinar. My name is Michelle Harrington. I am a registered dietitian on the Medical and Scientific Affairs team with VitaFlow North America. With me, also from Medical and Scientific Affairs, is my colleague, Elisabetta Johnson. We are excited to bring you this educational activity and introduce our speakers. Today's topic is Perspectives on GMP, Clinical Applications in the Nutrition Management of PKU. Please note this program is being recorded. You can access the PDFs of the handouts in the handout section in the control panel to your right. If you are tuning in via a phone line, don't worry if you cannot access the slide deck. It will be emailed to you at a later time. Financial support for this presentation was provided by VitaFlow North America, a Nestle Health Science company. The views expressed herein are those of the presenters and do not necessarily represent Nestle's views. The material herein is accurate as of the date it was presented. It is for educational purposes only and is not intended as a substitute for medical advice. Please note that questions will be addressed following the presentation. However, you are welcome to submit text questions into the questions pane at any time during the program. Questions relating to product will not be addressed during this webinar. Feel free to contact your VitaFlow representative for product information following the program. I have the pleasure of introducing our speakers today, Erin McLeod and Sandy Van Kalkar. Erin McLeod is the Director of Metabolic Nutrition for the Rare Disease Institute at Children's Hospital in Washington, D.C. For almost 10 years, she has followed a diverse patient population and participated in a variety of research activities. Erin received her PhD from the University of Wisconsin-Madison, where her research focused on the nutritional management of PKU. She participated with Sandy in the first clinical trials for GMP in PKU and examined how GMP may affect hunger and satiety cues. Sandy Van Kalkar is an assistant professor in the Department of Molecular and Medical Genetics and affiliated with graduate programs in human nutrition at Oregon Health and Science University in Portland, Oregon. Sandy is part of the interdisciplinary clinical team at the OHSU Metabolic Genetics Clinic. She teaches several classes in the nutrition program and also mentors master's students with their research projects. She is a founding member and past president of Genetic Metabolic Dietitians International, GMDI. At this time, it is my pleasure to hand it over to Erin.
Thank you so much, Michelle, for that introduction and for asking me to do this webinar today. So I'm tasked with providing an overview of GMP as a whole, as well as some of its bioactive properties. In addition, we'll be talking about how GMP can be used in PKU nutrition management. And then we'll discuss some of the practical implications of GMP formulas and how that might relate to your patients. But first, let's get started by doing a quick poll question. What we'd like to understand is how comfortable you are prescribing a GMP-based medical food for PKU. Do you feel fairly comfortable, kind of neutral, or uncomfortable with prescribing a GMP-based medical food? So I'll give you a minute just to pull that in. Great, so it looks like about 2/3 of you feel pretty comfortable with prescribing a GMP-based medical food. And I think that's great. I think that that has sort of shown how much GMP has been in the PKU space for a while. But I'd like to first start by talking about how GMP might be used in other areas and some of its more bioactive properties, not necessarily related to PKU specifically. So first on this slide, you can see that GMP has particular use in modulation of digestion and metabolism. GMP has been found to modulate cholecystokinin secretion in rats. However, this hasn't necessarily been reproduced in humans, and this is likely due to the dose that has been studied in particular. In addition, GMP can act actually as a prebiotic by increasing short-chain fatty acid production, and this in turn enhances growth of a healthy microbiota and prevents bacterial colonization. Moreover, GMP has additional antibacterial properties. It has been shown to decrease the adhesion of bacteria to target cells, and in particular, it inhibits the adhesion of bacteria onto teeth, and particularly the bacteria that can cause plaque and cavities. And so it is a common addition to toothpaste. In addition, GMP has a very unique amino acid structure, and that is where the realm of PKU has come into play. GMP is produced, next slide. So GMP is produced through, it's released from the cap and casein micelle after the addition of rennin during the cheese making process. And it is the third most abundant protein found in whey, and it naturally does not contain any aromatic amino acids. So this includes phenylalanine, in addition to the other aromatic amino acids, as you can see here on this slide. And so when it can't fully be purified from its original form, and so there is a small amount of residual phenylalanine that is contained within the GMP product to make PKU products. And so how GMP sort of came into the PKU world, I think, is a really interesting story. And it started in Wisconsin, where a researcher was looking at the properties of GMP and noted, sort of actually Googled and looked and saw, what is it that that can be used for an aromatic amino acid free formula or protein. And right down the street, he saw that the Weizmann Center treated these patients with something called PKU. And from that, a great relationship was born, and the Weizmann Center helped to really catapult the use of GMP in PKU patients. Next slide. And so for PKU patients, what is interesting is that because it is an intact structure or an intact protein, it actually hides a lot of the flavor and smells that come from an amino acid-based medical food, particularly the sulfur amino acids. It is deficient in amino acids, and so those deficient amino acids are supplemented in order to provide a suitable amino acid profile. And multiple studies have noted that there's a greater acceptability of GMP products and a preference for the GMP products when compared to amino acid medical foods. However, we know that research doesn't always translate into practice, and there is a comfort that individuals with PKU often have in their known formula. And this was something that really surprised me as I transitioned from the research realm of GMP to practicing with patients who have PKU. And many of them, although they may say in a first sip that they think it tastes better, after some time they always often go back to their original formula. And this, I think, has a lot to go towards that comfort piece. In addition, we've all heard patients talk about how they don't like the way their breath smells after drinking formula. And because this intact GMP formula doesn't have as many, or isn't as strong smelling as the traditional amino acid based medical foods, Tilley et al. Took a really interesting approach and actually were able to measure the volatile organic compounds in breath after 1 week of taking either a GMP formula or an amino acid formula. And they took 7 samples over 10 hours. And what was interesting is that they found no difference between the two groups with PKU, whether they were drinking an amino acid based formula or a GMP based formula. In addition, there was also no difference between those who had PKU and non-PKU controls. There was a suggestion that there was an increased volatile organic compounds of 5 minutes after taking the formula, but this dissipated within 30 minutes. And so it's one thing if it tastes better, but what does it do to the to blood Phe levels due to the residual amount of Phe that is found in formula. Next slide. And so first, the Wisconsin research group found that there was no difference in blood Phe when Phe intakes were greatly controlled in a short-term study. They later found that even when not controlling for one's Phe intake, there was no difference in blood Phe. And other groups have similarly seen no difference in blood Phe when a GMP product is used in combination with an amino acid medical food. However, Daly et al. Did note a statistically significant increase when somebody was on a GMP formula. However, you can see here that these Phe levels remained within treatment range. And so although statistically significant, they were still well within the recommended Phe ranges for PKU. And so taken together, this suggests that if an individual with PKU is already in good control, it may be more important to account for the Phe that is provided through the GMP product, and that more adjustments may be needed for the diet itself. However, considering both the effective Phe levels and introducing a new tasting formula, I'd next like to discuss a patient of mine. And so Olivia is a 2-year-old with PKU. She had a Phe tolerance of about 11 milligrams per kilo prior to a sepiapterin trial. When we conducted the trial, she was found to be responsive and had a Phe reduction of 58% within 10 days. And so when her Phe went down quite quickly, we did a Phe challenge using whole milk. And so we kept her food intake the same and just slowly increased whole milk into her formula. And this increased her tolerance to about 17 milligrams per kilo. We then transitioned her from an infant amino acid based medical food to a GMP based medical food over about a month, adjusting the whole milk content for the Phe that was provided by GMP. So during this time, her diet remained fairly stable, but we just accounted for the Phe and the GMP through the use of whole milk. Next slide. And so here you can see the change in her Phe levels. First, if you do one click, there we go. This was when we did the sepiapterin trial, and so you can see a quick reduction in her blood Phe. Next, we did the Phe challenge, and so we were able to bring her Phe back up and increase her tolerance while keeping her levels pretty stable. Next, this is when we adjusted her formula and transitioned to a GMP product. And you can see there was a quick spike in her Phe level just above 7 milligrams per deciliter. And this was accounted for because of the decreased calories found in the GMP formula that we were transitioning to. And so mom reported that Olivia was starting to eat a lot more free foods and was just hungry all the time. And so we adjusted for this and increased how much Phe she could consume, and we decreased how much milk was in her formula, and this was able to bring her levels back into control, and she was able to eat a wide variety of foods. Next slide. And so in this 2-year-old, we did a very early introduction of GMP, and this really allowed for a more reliable acceptance, I think. So, she's 2, and at this age, I have found that transitions to formula is usually a little easier than in our older children. And so by transitioning to a GMP product earlier, we didn't have as much of a pushback from the patient herself. In addition, there was an easier Phe manipulation in the formula because we were already mixing her formula with some milk, and so we were able to easily adjust this without changing her Phe intake or her diet that much. And by transitioning to a GMP product, and in this case, it was also a lower calorie product because she was still on an infant formula, this decreased the formula volume significantly. And so it really encouraged her to eat more solid foods and really normalize her feeding to be more similar to other 2-year-olds. And I think that mom has also commented to me that she, has really appreciated how much Olivia likes to eat free fruits and vegetables, and this lower volume of formula has really allowed her to do that. Next. So next, I'd like to talk about some additional GMP properties, not just that feed levels are relatively stable or that it tastes good, but what other aspects of GMP might be beneficial to individuals with PKU. And as I mentioned earlier, one of the bioactive properties of GMP in general is that it can act as a prebiotic. And this study looks at the use of GMP in mice, both comparing wild type mice, a GMP diet compared to a casein diet, as well as PKU mice comparing a GMP diet to an amino acid based diet. And in this study, they were able to show that GMP acted as a prebiotic to improve the gut microbiome and reducing indices of inflammation in particular. You can see here in this slide, I know it's a little hard to read, but the orange slide, that's the orange piece of the pie that's sort of pulled out a little bit, that's desulfobivogenase. And this genera of bacteria includes sulfate metabolizing bacteria that reduce sulfites and sulfates that are obtained within the diet. And high levels of this bacteria have actually been connected to patients with ulcerative colitis. And so you can see here when both wild type mice and PKU mice were fed a GMP diet, this specific genera of bacteria was significantly reduced. In addition, there has been reports of improved GI symptoms in teens and adults when consuming a GMP diet. And so this hand in hand goes to the potential for GMP to act as a prebiotic in individuals with PKU. Next. In addition, a lot of the work that I did at Wisconsin was looking at how GMP can affect digestion and metabolism. And we found that post-meal ghrelin was lower after a meal of GMP compared to an amino acid-based medical food. And you'll remember that ghrelin is sort of the signal to tell you to eat. And this effect was shown in addition when comparing 4 drink mixtures of GMP, amino acid, or a combination. And a number of studies have not found significant effects on a visual analog scale looking at hunger and satiety. And so really trying to pinpoint some of the effects of GMP on digestion and metabolism and satiety have been challenging and have been conflicting. And this is another source of additional research. However, the addition of GMP to a traditional amino acid-based formula is something to consider. I think given the possibility for GMP products to improve satiety measures, one possibility would be to add a GMP formula to an amino acid-based formula, particularly for individuals and patients who have a harder time with the transition and really like their current formula and their current amino acid-based formula. Adding a GMP product to their current formula could increase the amount of medical protein without significantly changing the calories that are found in their formula and without significantly altering the taste of the formula. Since GMP does have a much more mild taste, if you add a GMP formula to a standard amino acid-based medical food, you really don't taste, most people don't taste the GMP in their formula. So this is another thing to consider and a way to possibly add GMP to your patient's formula regimen. Next. So another bioactive property of GMP is actually its use on bone and how it may affect bone remineralization. And the Wisconsin group again looked at this specifically in individuals with PKU and found that the renal acid load is quite increased when individuals take an amino acid-based medical food. And what they did was they looked at the urinary calcium and renal net acid excretion, and you can see here that those were positively correlated. And this suggests that the renal net acid excretion is associated with increased urinary calcium, and this possibly could be from increased bone resorption. In addition, they found a higher calcium to phosphorus ratio, which may be favorable with a GMP medical food. And further, the prebiotic properties that we spoke of earlier may actually affect the bioavailability of micronutrients and might affect how the body is able to absorb calcium. And all of these taken together suggest that GMP might improve the bone long-term of individuals with PKU, and this is another area that continues to be looked at and researched. Next. So I think if we look at all of the possibilities for GMP, we've learned a lot over the last 10 years, and I think we all agree that GMP has really expanded the medical food options for those with PKU. This has been done, though blood Phe control may be unchanged. I think that GMP may potentially be improve blood Phe stabilization throughout the day, and this has been shown in a few studies that suggest, particularly for individuals who might take their formula all at once. And I know we all have those patients where they drink all of their formula in one shot. There has been some suggestion that GMP, it's a little easier to space out the GMP throughout the day, and that in addition will help to improve the Phe stabilization. Also, I think that a transition to GMP earlier in life may improve the acceptability in young children. And so really considering when the best time is to introduce a GMP product, or at least a little bit of a GMP product to young children, is something to consider, so that they start to develop a taste for the GMP as well, and start to have some of those added benefits early on. And finally, I think research continues on how GMP may affect bone development and the microbiome, and I think this is a really great new avenue for us as dietitians to really look at not just how we can keep our patients' Phe levels good, but how we can really improve their overall quality of life, and how we may affect their bone and the microbiome as well. So I think with that, we will just do another quick poll. So what percentage of your PKU patients are currently taking a GMP-based medical food? Do you think it's about 75% or higher, 50 to 74%, 25 to 49%, or none of your patients? Give this just a minute. Let's see. So it looks like about 70% of you have at least a quarter to a half of your patients consuming some GMP-based medical food. And I think that that's a great start to really start small and see how it's going. And then we all have those patients that it's hard to transition, or maybe those that we think aren't quite right. And I think, as I've outlined, it might be a good idea to think about even adding GMP to some of your well-controlled patients, and possibly how to do that, as well as those who are returning to diet I think that when GMP first came out, that's sort of the idea, was that it was a new tasting formula, but I think we're learning more about the positive bioactive properties of GMP, and maybe this is a time to really work to transition patients to be consuming more GMP products. And these are a list of all the research that was done during this talk. So feel free to look it up. There's some really great research being done right now, and it's really interesting. And now I'll turn it over to Sandy to talk about their really exciting study.
All right, good morning, everybody. I would like to talk about a study that we completed with VitaFlow here at OHSU. Both myself and Joanna Hansen were the PIs for this study. So these were the objectives of the study. The study was done in 2 different arms. Arm 1 was to evaluate the acceptability of PKU Spear during a short-term trial. And so this was a 1-week trial, and the individuals with PKU aimed to consume a minimum of approximately 30% of their estimated protein needs. Those that completed Arm 1 were then invited to participate in Arm 2. This was a longer-term acceptability study, which also included evaluation of metabolic control. Again, in individuals with PKU, here they were consuming 100% of their medical food component of the diet as PKU Spear, and this part of the study was 4 weeks long. So we'll talk about Arm 1 first. Again, this was a 1-week trial. Our objectives were to evaluate adherence. So we did have a formula intake questionnaire that they completed each day. We had an acceptability and satiety questionnaire, which had various questions about appearance, taste, flavor, ease of use, and we will go through this data. And then we also had a daily GI tolerance questionnaire, as well as consumption logs that they filled out each day. So for this study, we had 22 subjects. The mean age was 24 years. We had quite a range of ages, 4 to 55 years. We definitely had more adults participate and adolescents than we did younger individuals. And I think we noted this was primarily because of resistance in the pediatric patients who really liked their formula to want to try something else for a week. For this study, we used the powdered PKU Spear, which was either 15 grams protein equivalents or 20 grams protein equivalents, and different flavors, vanilla, berry, chocolate. And again, our target consumption was 30% of protein equivalent needs, although some consumed more than this. So this table just shows you the approximate amount of PKU Spear that we did recommend for different ages. So for those over 14 years, we did use 1 packet of PKU Spear 20, providing 20 grams protein equivalents. Go ahead. So this is some of the data from the acceptability questionnaire. Here we asked about what they felt about the appearance of both their baseline formula and then at the end of the week, what they felt about the appearance of PKU Spear. The different colors represent different answers to this question. Here I am combining both the blue and the red in these graphs. So blue means I liked the appearance a lot. Red means I like it a lot. So when we combine those two, For their baseline formula, 43% of the participants said that they liked it a lot, their baseline formula. When they changed to PKU Sphere, that increased to 72%, suggesting or indicating that the participants felt that the PKU Sphere looked better to them than their baseline formula. Here's the same kind of data for the taste. Again, the blue and the red, which is I liked it a lot or I liked it. For their baseline formula, 38% of the participants selected these two answers versus 57% after 1 week of taking the PKU Sphere, suggesting that more of the participants felt that PKU Sphere tasted better to them. Smell, this one was, there was a big difference. Again, liking it a lot or liking it, 10% of the participants felt this about their baseline formula, and that increased to 43% after 1 week taking the PKU Sphere formula. For the texture, again, we saw an increase in those that felt they liked it a lot or liked it, from 33% for their baseline formula to 67% after a week taking the PKU Sphere. I think you're starting to see a trend here in what people felt about the Sphere product. This question we asked if individuals were having problems taking the formula. At baseline, 62% said, no, I don't have any problems taking the formula. That increased to 86% after a week of taking the PKU Sphere. Go ahead. So this table, we asked them what kind of problems do you have taking the Sphere or taking the formula. I'm not going to go through all these numbers, but I will point out that those that responded, no, I did not have any problems taking the formula, 5 out of 20 said that about their baseline formula, and that increased to 12 out of 21 said that from after taking PKU Sphere. So again, an improvement in those that felt they were having problems taking their formula. The ease of preparation, again, you will see an improvement here with the baseline formula. 62% they felt they had problems, or it was easy to prepare their formula, versus 86% of the participants felt that it was easy to prepare the formula on the PKU Sphere. Another question we had is, how easy is it to take all of the formula? So again, those that responded very easy or somewhat easy, 33% for the baseline formula, and that increased to 62% on the PKU Sphere formula after a week. Again, suggesting that the participants felt the taking Sphere was easier. It was easier to take all of the formula. We also wanted to evaluate satiety. So this question was, how full do you feel after taking so the baseline formula? 71% said they felt very full or somewhat full, and that decreased to 48% after taking the PKU Sphere. For many of these participants, the Sphere was a lower calorie option than what they were taking as their usual formula. And so this certainly makes sense if you consider the differences in calories. So just as a conclusion of the arm 1, the overall PKU sphere was well tolerated based on the different questions. We did ask about GI symptoms, and this was done at the end of the week. This was done every day during the week. So 5 patients did feel that they had some abdominal bloating, fullness, or distension. That was the category with the most respondents. There were a few that reported constipation, abdominal pain, or diarrhea. However, only 4 of the 21 patients felt that these GI symptoms were not typical for them. So suggesting that possibly the 4 patients, this may have been related to the PKU sphere. We didn't ask the subjects if they felt that these symptoms were related to the sphere. It was hard to interpret, but certainly these are small numbers and few issues with GI symptoms. So I'll say a little bit about the arm 2. This was a 4-week trial. Again, the participants, the goal was to take 100% of their protein equivalents from sphere. They needed a 2-week washout. So after arm 2, they went back to their usual formula for 2 weeks. For this part of the study, 9 subjects who completed arm 1 moved into arm 2. Again, these were basically adults, except for a 17-year-old. And then the assessments included a daily intake log, daily GI tolerance, acceptability questionnaires, were completed baseline 2 weeks at the end of trial, did weekly blood spots, we did plasma amino acids at baseline and end of trial, and then they filled out a 3-day diet record both at baseline and end of trial. So briefly, our findings from arm 2, we did see good adherence. Subjects consumed their entire recommended volume, 85% of those total days. We didn't see any significant change in blood Phe, although 2 subjects did have a clinically significant decrease, which I'll show you in a second. The amino acids had normal plasma amino acid profiles. So both at the beginning and end of trial, tyrosine, branched chain amino acids, methionine, threonine remained in the normal range. Given that GMP does require some amino acids added to provide a complete amino acid profile, we wanted to show that those amino acids that needed to be added remained in the normal range, which they did. Next slide. These are different lines represent the 9 patients and their Phe levels baseline and then weekly throughout the trial. You can see they are all over the place, which is not uncommon with what we see with all of our patients. I did want to point out the 2 patients that did have good reductions in their Phe level, about 750 micromole per liter decrease. And those are the blue stars and the blue triangle shape. I don't know what shape that is, but you can see that they decreased. These 2 subjects did increase and improve their formula intake over time, and so it was nice to see this good decrease in their Phe levels. These are the tyrosine concentrations measured during the same time, and you can see with those 2 subjects that had significant decreases, in their feed, they had a significant increase in their tyrosine levels. So something that would be expected with better formula intake. We did have more positive scores on the acceptability questionnaire. So those questions that I went through with ARM 1, we saw the same kind of changes in those questions during ARM 2. There were few GI problems noted. Again, the most common was the abdominal bloating, fullness, or distension. 2 subjects reported these with 18 instances between the 2. However, 17 of those 18 instances were from the same subject who did have a reported history of GI distress. So again, I think we can say that individuals had few issues with GI problems taking the sphere. For ARM 2, again, the satiety type questions, half of the subjects felt less full taking the PKU sphere compared to baseline. At baseline, pretty much everyone said they felt very full or full. And then after the 4 weeks, about half of the subjects reported feeling very full or full. And again, this reflects the differences in calories between their baseline formula and the PKU sphere. 3 of the 9 subjects were consuming low-calorie formulas at baseline, and their fullness answers did not change after taking the PKU sphere for a month. And then finally, our last observation was that 6 of the 9 subjects chose to remain on PKU sphere after the trial. So they were given the option to change to PKU sphere. We did add it to our formulary. And again, 6 of 9 did decide to remain on PKU sphere, again, suggesting good acceptability and good acceptance of this product.
So we would like to know, what is the youngest age you would consider starting a PKU patient on a GMP medical food, GMP-based medical food? Less than 1 year, 1 to 2 years, 3 to 5 years, 7 to 10 years, or greater than 10 years? Again, I'm going to give this a few seconds here. Interesting. 50% at 1 to 2 years of age, 29% 3 to 5. No one over 10 years of age. I would like to, at this point, thank Erin and Sandy for such an excellent presentation. I'd like to encourage you to use the questions pane to submit any questions. At this time, I think we could take a few. I do have one. This is from Andrea. Were the PKU baseline formula GMPs from other companies or only amino acid formulas?
That's a good question. Yes, all of the patients were on amino acid based formulas. I would have to check for ARM 1, but definitely ARM 2, they were all taking some different, but amino acid based formulas at baseline.
Okay. I'm going to give it a minute to see if anyone has any other questions. That's the only one that I see right now. Okay, I just got another one. This is from Taryn B. When assessing protein needs, do you add the 20 to 40% extra for L-amino acids?
Erin, do you want to answer that?
Sure. I mean, I think we do tend to try for a higher than the RDA for the goals, and we often follow the GMD guidelines that have been published for PKU and for protein requirements. That is not different, and we don't necessarily take that into account differently if a patient is on GMP or amino acid formulas. I think, and we do, with some of our patients who have a higher tolerance, we might look at that a little differently depending on how much is coming from a medical food versus how much is coming from the diet and a food totally. But generally speaking, we do try to aim for a higher protein need. Sandy, do you as well?
Yes, I would say we do the same, especially for the younger patients. For the older patients, I think our goal has been to hit the DRI from the medical food, and then their foods are on top of that. So the total protein does end up to be around 120%. Certainly we have those that will take more. Like Erin, those that have a high Phe tolerance, will take that into account with our recommendations for grams of protein from the formula. But in general, I would say 120% as a total protein, probably higher for the younger patients, is our goal.
Okay, great. Okay, I have a question from Anne. Were the patients with the major drops in level more adherent during the trial?
Yes, so these were 2 patients that were struggling with their formula at baseline. So their formula consumption did improve during the month on Sphere. And so what you're seeing in those graphs really represent their ability to increase their formula consumption with the Sphere compared to their baseline formula. So we took all comers. Some people were struggling with their baseline formulas. Some people, like their formula, although again, these were older subjects, so I won't say everyone was jumping up and down in excitement with their baseline formula. And I will say the scores from the acceptability questionnaire in general were more positive for all 9 subjects, whether they liked their baseline formula or like those 2 were taking inadequate amounts for sure.
Okay, Anne says a big thank you.
Well, thank you.
Yeah, Mary is asking if this presentation will be available on the VitaFlow VIA website. And yes, there will be a recorded version up there probably in a couple weeks. Mary says thank you. I do not see any other questions at this time. So I think I would just like to thank our speakers again and our audience for your participation. On behalf of VIA, VitaFlow in association with you, Elisa Vetta and I hope that you found this information valuable to your practice and that you enjoy the rest of your day. Thank you.
Thank you.
Thank you all.